Today's lecture is on office equipment and supplies. Computers. Computers come in a variety of shapes and uses. We have a desktop, we have laptops and notebooks, we have sub-notebooks and tablet PCs. We have personal digital assistant, which is a PDA. We have cell phones and the internet. We have landlines and Wi-Fi to make those connections. Components of the computer. Physical components are usually called hardware, such as input devices, your keyboard, your pointing devices, as in your mouse or your touchpad or touchscreen, your modem, it's either cable or fax modems, and your digital subscriber line known as a DSL. Your scanner is also a component of your computer. Processing devices. The motherboard is the main circuit board, and it controls other components in the system. The central processing unit, or the CPU, interprets and executes programs, such as the software you use. Most important piece of hardware in your computer is your CPU. Storage devices. We have memory, random access memory, known as RAM, and read-only memory, known as ROM. Hard disk drives, removable drives, CD-ROM, and burner. An external hard drive that you can add to the drive that you have for more space, or a jump drive, or zip drive, or DVD. Output devices. How do we see the information that's in our computer? Well, we look on a monitor. It can be an LCD display with different resolution. Or we can print it out on the printer, which is either laser printer or an inkjet printer. Software are programs to use with the computer. There are operating systems such as Microsoft Windows or Linux, Apple, and many others. Windows uses icons or graphical symbols of GUI interface, such as an Excel spreadsheet. There's a little symbol that's green. Database is a collection of stored records. We use databases in research. One of the databases we use in research is how many people use public healthcare services to receive their vaccinations each year. That's a database. Applications. We have Microsoft Office, which includes Word, PowerPoint, which we're using now, Excel, Access, and Publisher. Other applications are Meddare, Medasys, and Medisoft. Others, such as Cerner and Epic, are applications as well. We have the optical character recognition, or the OCR application, and this is software which converts images into text. Using application software, we use word processing, database management, accounting and billing, appointment scheduling, electronic transactions such as email, online services, and the internet. Software training. How do we learn to use new software programs in the office? Well, we go to classes and tutorials where you can turn it on and learn how to do it while you're at the keyboard. Documentation and technical support. Technical support will check systems and read manuals, will help you take care of your problem, but they ask you to do a little work first to check the system and read the manual, and maybe you can solve the problem on your own. Or ask a supervisor or coworker for advice. Follow the help desk advice, allowing for uninterrupted time near the problem computer to solve the issue. What about selecting computer equipment? How does a practice manager do this? Well, if you're upgrading your office system, then you're going to start to look for new equipment. You're going to be selecting software, maybe adding a network, virtual private networks or VPN connections, such as local area network connections or wide area network connections. Choosing a vendor. Who are you going to buy it from? Technology advances. Are you using telemedicine? Do you need speech recognition technology? Computer system care and maintenance. Care for the system unit. Your unit needs to be in a well-ventilated location, and it needs to use a power strip with surge protector. It needs to have screensaver for the monitors to cut down on the use on the screen, but also for HIPAA policy. Ink and toner for printers, and the proper handling and storage of those jump drives and CD-ROMs. Security in the computerized office, and this is part of the high-tech policy, which is part of the electronic security safety for HIPAA. You have to safeguard confidential files. How do you do this? By using passwords, by using encrypted software when you email a patient record to another physician, and activity monitoring system. So once you sign on to your computer at work, there is a background system that's monitoring how many times you're signing on, where you're signing on, and what you're looking at. Preventing system contamination. We use antivirus software like Malwarebytes and firewalls. And we have a computer disaster recovery plan in place. Administrative medical office equipment includes facsimile machines, known as fax machines, to transmit images over the telephone line. The cover sheet with a disclaimer needed to help keep protected health information from being wrongly disclosed. And benefits of fax technology. The benefits of fax technology include the ease of use and the quick access and transmission of information, so you don't have to wait for snail mail to get it there. Typewriters. Do we use typewriters in the office? Photocopiers with special features. Double-sided. They can copy photos as well as printed word. Adding machines and calculators. Folding and inserting machines for mail. Postage meters replaces the use of postage stamps, and it can also seal envelopes. It saves trips to the post office and allows for more accurate postage expense because it will actually weigh the envelope such that you're going to mail and put the correct amount of postage on it. They show weight and amount of postage required, and they lessen the chance of return mail for postage due. Dictation transcription equipment. These days, a lot of that equipment is right in the EMR or the EHR that the practice is using, so the practitioner will dictate while they're in with the patient, and they will dictate the patient visit right there onto the computer system. Check writers, paper shredders. We need paper shredders now to make sure that patient information is not trackable. It does destroy confidential material. It eliminates old patient records and other sensitive material. And you have a contracting vendor, would still be considered a covered entity and must comply with HIPAA law. Who are some of the paper shredding companies in your area? Iron Mountain's one of them. I think they're all over the United States. Purchasing decisions for office equipment. So if you're the practice manager, this is what you need to do. You need to evaluate the office needs. You need to start contacting suppliers and evaluate warranty options and price options, and then prepare a recommendation. So is Staples cheaper than WB Mason for office supplies? And what is a good vendor for refrigerators or exam tables? All right. The leasing versus buying equipment. Is a lease agreement easier to use on a copy machine? A lot of copy machines, sometimes they're leased, sometimes they're bought, and then they have maintenance contracts with them. So you need to look at the advantages and disadvantages of leasing equipment. Maintaining office equipment. You have to maintain the equipment manuals. Every time you get a new piece of equipment, all that paperwork needs to go in its own plastic sleeve or in its own binder. You need to maintain maintenance and service contract visits. Troubleshooting. Every time you have to troubleshoot for something, you need to keep a record of that. What are your backup systems for your phones? Electricity? Do you have battery power? What about your fire extinguishers? Are your fire extinguishers maintained, and are they checked every year by your fire extinguisher company? Equipment inventory. Determining the responsibility for organizing supplies and maintaining office supplies. Categorizing supplies. We have vital supplies, incidental supplies, and periodic supplies. Who's in charge of what? Storing office supplies. Where do we store them? What kind of cabinets do we use? Are there administrative supplies and clinical supplies? So the clinical supplies are probably stored in the patient rooms or in a locked storage room. Some clinical supplies need to be refrigerated, as in the vaccine sera for children's vaccines and for flu and pneumonia. Taking a supply inventory. What is your responsibility? And what is your inventory filing system? Is it an inventory card or a record page? It is on a computer. Do you have reorder reminder cards, or does your computer flash up and say, it's been 30 days since you ordered tongue depressors. Do you need more? Scheduled inventory and ordering. And so you establish ordering times. When do you order ahead of schedule? What about unanticipated shortage of supply item? They were using the Bayer pharmaceutical company produces the shingles vaccine. And obviously they did not plan ahead because last May they ran out of vaccine and said they would not have any more available until January of 2020. So that would be a scheduling inventory problem and a planning ahead problem. They'd have to do some research. I think they did some research and found out that the number of people that they anticipated getting the vaccine was much, much lower than those that actually wanted it. So there again, do you have enough shingles vaccine to take care of your patients? Do you have enough tongue depressors? Do you have enough point of care testing? Do you have enough syringes? Do you have enough table paper? And the medical assistant is responsible for the supplies in the room that they take care of. How about ordering supplies? You have to locate and evaluate supply vendors, and this is what the practice manager does. You will gather competitive prices, you'll set up a budget, you compare vendors, you look at the pricing versus quality. Is it unit pricing? You're going to look and see if your vendor can do rush orders without any high cost. How about mail order companies, purchasing groups, group buying pools like BJ's or Sam's Club, and cost controls? This is all what the practice manager has to work on. What are the benefits of using a local vendor? You can get in touch with them right away and they might be able to supply you right away. Payment schedules. How, with each vendor that you work with, do they expect to be paid on the day that they deliver the product? Is there a 10-day waiting period? Do they bill you every month? So we have to look at payment schedules as practice managers as well. Ordering procedures. How do we order this? Is there a form? Is there a requisition and a purchase order? Are there checking, or do we check the orders received to make sure everything is there? Do we correct any errors? We look at the invoices, and then we send out the disbursement or the payment of funds to the vendor. Most order forms are now online. How about avoiding common purchasing mistakes as the practice manager? Be aware of dishonest solicitors. Verify your vendors with the Better Business Bureau. Be careful for bait and switch tactics. We'll give you a great deal on 10 cases of copy paper, but when you order the 11th case, you find out it's twice the price of the ones you were paying for. That's a bait and switch. Develop professional rapport with the sales representatives and the delivery guys, whether it's UPS or FedEx or it's WB Mason who deliver their own supplies or staples. Develop a professional rapport with these people and ask questions. If you don't know, please ask questions of your vendors. That ends today's lecture. I will talk to you again soon. Take care.